All right, we're gonna start with some prone breathing. So we're gonna go face down, so you're on your stomach. We're keeping elbows by your ears, forehead rested on your index slash thumb, flat on your belly, good. We're keeping elbows to about ear height. We're slightly pushing the elbows and pinkies down and slightly back towards our lower ribs. We're keeping neck long, chin slightly tucked, chest wide. Thinking about inhaling, slow and controlled exhale. And think about like that 360-degree breath, breathing into all sides of our rib cage. Slow and controlled. Good. Good. See the back slightly elevating on the inhale. It's good. Really trying to maintain those cues the whole time. Neck elongated, chin slightly tucked, chest wide. Elbows, pinkies down into the floor. Good. Actually, can you tilt your screen down slightly? If you don't mind.
I have my earbuds in today.
Good.
So no magical Scott coming to help with those.
All good.
Good?
Perfect. Yep. Just so they can see elbows to about ear height. Yep. Good. 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 All right, let's do one more breath. Good. Okay. Actually, do you remember the rolling thing I had you do where you were starting on your stomach with like your arms and your legs out and you were trying to use your arm and your leg?
Oh, yeah.
Do you remember that?
Yeah, vaguely.
Can we run through that?
That one I have not been practicing.
That's okay. That's okay. So let's start, on your back or on your stomach. Doesn't matter which way. We'll do both. So we're going to bring arms overhead. Yep. Yep. And then let's start with your right arm. So you're going to use that as your lead. Yep. So think about it's nice and slow and controlled. Yeah, you're using that to bring like your whole body across. So you roll until you're completely face down. Yeah, there you go. And then go back the other way with the same arm. So you're kind of bringing that back and over. Yep. Slow and controlled. Good. Try to keep arms, like above your head the whole time. Yeah. Good. Lead with, yeah, that same arm. Yep. A little easier going backward than forward.
Yeah.
Try not to bring it like up across your body. Try to keep it above your head. Yeah, there you go. Better.
Okay.
Try slow and controlled. There you go. There you go. Good. It's good pulling drill.
Yeah, I feel like I still wake up in the middle of the night from rolling over. Like, not that it's like excruciating pain by any means, but like I still like wake up every night.
Okay.
I actually feel this loosening up my upper back too, which is really nice.
Yeah, good. Yep. Lead with the arm. Try not to use your leg. I know it's hard.
It's impossible.
Try setting your breath first. Remember to use your breath. Good. Better. Good. Let's do 2 more. Good. Good. All right. So now, yeah, stay on your back. Let's bend your knees so your feet are on the floor. So knees, feet about hip width apart. Yep, arms by your side. Palms face up. Good. We're keeping neck slightly elongated, chin slightly tucked, chest wide, cinching the ribs down towards your belly button, pelvis, but we're not flattening the back. We're keeping a little bit of that nice lordosis in that lumbar spine. And same thing, thinking about that 360-degree breath, pushing front, side, and back. Nice, easy inhale for 3 seconds. Slow and controlled exhale for about double the time. And if it's easier for you to feel this on yourself, just to make sure you're in the right or on the right track, put one hand on your chest, one hand on your belly, and think about no movement with that top hand, all the movement with that bottom hand. Good. And then we can bring hands to our lateral ribs. So kind of on either side. Good. And same thing with that breath. Think about pushing outward into those ribs. You can see if one side of your rib cage maybe moves or does not move as much as the other. They should be both expanding equally.
There's a difference from last time doing this.
Yeah. What do you feel?
They're moving more equally as opposed to last time.
Do you remember
I think
last?
last time, yeah, it was my left side that was not expanding as much.
Yeah. That's great. So we're still keeping those cues. Yeah, neck long, chin slightly tucked, chest wide. Good. And then the last thing, yeah, we can bring hands to our, the space between lower back and the floor. So it's not like you're sitting on your hands, but yeah, they're kind of between that space of the curve of your lower back and the floor. And then still keeping up with that same breath, but thinking about using your lower back muscles to expand on the inhale into your hands. So you can check on yourself to see if you are accessing all of those points 360 around trunk for some good diaphragmatic breathing. Good. Still keeping neck long, chin tuck, chest wide. Making sure your hips are even too, yeah, that you're not super anterior tilted or posterior tilted. Everybody has a different neutral. Good. Let's do two more. Okay. And now let's bring arms to our side. And then let's have you widen the feet a little bit just so they're slightly wider than, yeah, hips. And we're going to do that kind of nice rocking back and forth with your lower half. So you're rocking to one side, you're rocking to the other side. Yeah. It's nice and slow. Slow and controlled. There you go. Good. Yeah, just not allowing like the legs to flop around. Good. Good. Nice and easy. Just seeing where your breath falls naturally. Doesn't have to be inhale, exhale. One way or another with the rocking. But still thinking about that 360-degree breath, keeping those cues. And then let's add in the heel of the opposite leg. So as you're falling to the right, the left heel is going to push down into the floor. As you fall to the left, right, kind of that inner back part of your heel grounds into the floor. You should feel that in your glute, hamstring. Good. Keeping neck long, chin tuck, chest wide. We're rocking our lower half back and forth, slow and controlled. Allowing our breath to fall where it may. Good. Good. Let's do 2 more. Good. Good. Okay. So now we're going to come into supine 90-90. So can we actually have your heels up on like your couch or chair if you have that?
Mhm.
Oh, we're on your back. Sorry.
Yeah.
On your back. Yep. We'll get to that one then. Yep. So heels up on the couch, or if you have a chair, yep, just the heels.
Oh, yeah. Okay.
Yeah. So making
Gotcha.
sure, yeah, hips and knees are about 90 degrees. So bring your knees a little bit closer to your stomach, chest. A little bit more. There you go. Yep. So it's literally just your heel that's on the couch, right? In this
Oh, gotcha.
yeah.
Okay.
All good. Making sure, yeah, knees, hips are about, I'm sorry, knees, feet are about hip width apart or slightly wider.
Okay.
Yep, good. So we're keeping neck long, chin tuck, chest wide, ribs down. We're actually going to bring arms up. Yes. So elbows slightly bend. We're cinching in those shoulder blades down and back. So slight external rotation of those shoulders. Yep. There you go. And then we're lightly pushing the heels down into the couch or chair. Good. Thinking about that 360-degree breath. Pushing front, side, and back. Inhale, slow and controlled exhale. Good. 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 Keeping neck long, chin slightly tucked, chest wide. Good. Good. Now, can we maintain some intra-abdominal pressure? And then one heel at a time, you're going to lift one heel up off the couch, keep the other on the couch. Hold that for a couple seconds, then switch, making sure we're keeping that intra-abdominal pressure. So it's that pressure from the inside that's pushing outward on all sides. It's not bearing down. It's not this crunching motion. Imagine if you had like a belt 360 around your waist that you were trying to push outward into the whole time. Good. 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 Let's do 2 more. And then let's keep the heels now on the couch. Yep. And let's move your arms now. So one arm at a time, back overhead. Yep. Still keeping those cues. Only go as far as your trunk will allow you to maintain that pressure. And remember, we're not pushing our back into the floor. We're keeping a little bit of that lordosis in that lower back. Trying to keep all of our natural curves in our spine. They're there for a reason. Good, nice and easy. Breathing the whole time. Good. Let's do one more. And then I'm gonna have you flip. So now your arms are, or hands are by the couch and your legs are the opposite direction. Good.
On my back now?
Yes, on your back. Yes. Yep, let's make sure there's enough distance between. Yeah, there you go.
Headbutting myself.
Yeah, all good. So making sure, yeah, your elbows are over your shoulders. Yeah, they're not flared out to the side. Perfect. We're keeping, yeah, legs in that same position. Bring your knees a little bit farther. Yeah, there you go. There you go. And then
Core engage.
Yes. Yes, exactly. We're going to keep our knees a little bit wider than our hips and then angle your feet towards each other slightly. Yeah.
Oh, kind of like what I was doing with my hands.
Yes. Yes. Yeah. There you go. Good. Now we're going to maintain some light pressure into the couch. So think about you're pushing kind of your whole body away, keeping those elbows over your shoulders best you can. Good. Still thinking about those cues, neck long, chin tuck, chest wide, ribs down. Cinch your ribs down slightly, push towards your belly button. Yeah, better. Good. Still thinking about that 360-degree breath. Again, we're not pushing our back into the floor. Keeping those.
Yeah, it's hard to do the chest piece without compromising the lower back.
Yes, yes, it is. Might have to play around with it a little bit.
Yeah, I need to reset
it's very slight. It's not like it's this big motion of like pushing the ribs down. It's very slight, just cinching them slightly down.
Yeah, like right here.
Yeah.
Right here versus like back here necessarily.
Right. Exactly. Yeah, I think a lot of us don't really have a ton of control and the ability to like separate like our lower ribs from our back. I think it's just we've lost a lot of intersegmental control of our spine. Yeah, just because we tend to be very static throughout our days now. So it's not like we're really forcing these areas to move a ton on their own. So I'd say a lot of these exercises can be challenging at first, but I think you'll be pretty surprised at what your body's really actually able to do with a little bit of practice and self-discipline. I don't think we give ourselves enough credit sometimes.
We went for a walk yesterday. So like we went for a 4-mile run. And then I think I clocked it. It was like a 10-mile walk, just like around Brooklyn.
Yeah.
My legs are so tired from it. Like holding this, it's like way more tiring than usual. I'm like, why is a 10-mile walk doing that to me? Don't worry, I was being safe and wearing a face mask.
That's good. No. You need some fresh air. We all need fresh air. I think those benefits of sun and air outweigh the the possibility
to be in
of,
quarantine.
yeah.
Yeah. Yeah.
All right. So let's keep that pressure into that couch. And now we're going to start to move your legs. So again, we're not straightening the knee. Yeah, we're just kind of dipping the heel down towards the floor, trying to work purely on motion from your hip, not your knee or your ankle. Try not to curl your toes too much. Yeah, try to keep those toes relaxed. Yeah, slight dorsiflexion in the heels or the ankles. Good. Slow and controlled, keeping that breath, keeping those cues. Good. This looks good. Good. Neck long, chin tuck, chest wide, ribs down. Good. Let's do 2 more. Good. Okay. So now let's have you come into a quadruped position. So you're just gonna
Yes, my favorite.
your favorite. I love it. On all fours. Yeah, I feel like the more I'm doing this too, I think I like quadruped a lot too.
Yeah.
It feels comfortable to me.
Yeah.
Maybe not for everybody, but all right.
Yeah.
Yep. So
I don't know. There's just something about it.
yeah. Can you face the side? Actually, do you mind?
No.
There you go. Perfect. Yep. So we're keeping wrists under shoulders, knees under hips, toes tucked in the back. Perfect. Shift your whole body forward, 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 forward. Right there, right there. Right there. Walk your hands a little bit farther away from you. I'm sorry, yeah, forward. Too much. Just so they're under your hips, under your shoulders. There you go. That's it. Better. Now shift. I just want to bring your knees slightly forward now. There we go. That's it right there. Hold that. That's it. Just making sure everything is directly aligned with one another. Perfect. All right. So we're keeping same cues, neck long, chin slightly tucked. We're pushing the ground away from us. So we're not losing that kyphosis in our mid back. Yeah, try to push through a little bit more, Em. That's it. Better. Yeah. Good.
Through here or through here?
The first one.
Okay. Yeah.
Yep. I'd say for a lot of us, yeah, that have these really straight, like mid backs, I'd say this is a good one to practice. Try to get that kyphosis back.
Yeah, this is like so tight. It's crazy. Like,
yeah. For a lot of us, that area usually gets pretty tight. But again, yeah, we're working on stability of our trunk, which again, our trunk is not just our core, or our core is not just our trunk. Think about pretty much like neck to pelvic floor. So really trying to maintain all of those cues, pushing the ground away from us, keeping neck long, chin tuck, chest wide, hips even, ribs down. Yep, think about breathe. Inhale, slow and controlled exhale. Good. And now we're going to imagine a glass of water that's on your back that we're trying not to spill. And then let's work on just the arms. So either we can pick just the hand up an inch off the floor, or if you're a little bit more comfortable, you can raise directly overhead. Yeah, that's fine. Just creating a little bit of instability. Good. Keeping those cues. Good catch. Still breathing. So everything pretty much below the shoulders is super stable. not allowing much motion to happen here. Good. Good. Let's do 2 more. And now let's work with the legs. So either, yeah, we can just pick a knee up off the floor, or again, we're moving from the hip. So we're not straightening the knee out. We're thinking about just extending backward slightly from the hip.
Like that?
Try not to kick your heel up towards the ceiling. Think about kind of more of like a, not like a donkey kick or like a fire hydrant kind of thing. So we're moving that.
Oh, like this way?
Yeah. Kind of like
Okay.
out and back.
Okay. It's like something they have you do in bar almost. Not quite though.
Not quite. Yeah, like that. Yep.
Like there. Okay.
Yep. Back down. Yep. And again, we're trying to imagine that glass of water on your back. That's, or wine.
This one's way more challenging than the arms.
Yes. There we go. Yep. Because we're working on pure hip extension here. Good. Try not to allow that pelvis to rotate too much. Yeah, that's it. Much better. Yes, that's it. Better. Try not to rotate too much. Better. Good.
When you said rotating the pelvis, is that like rotating this part, like the hip, like
Yeah.
like the front bone, like not having that move back and forth, but just moving like the butt part?
Right. Exactly.
Okay.
I mean, very slightly, I can see kind of like this, like rotation happening.
Yeah.
Is just that.
So should I stop before I feel that starting to engage?
Yes, exactly. Okay. Yeah. So it's okay to shorten the range of
motion. So I'm going to be able to, yeah. It's like, it's going to be really mini.
Yeah, that's fine. That is totally fine. I'd rather you do this with like the highest amount of quality versus just trying to get through reps and like moving past the range of motion where it just doesn't become as efficient anymore because you're not utilizing like your whole intrinsic system to keep yourself super stable. I think that's a mistake with a lot of exercises. We start to like compromise stability for mobility. Like we're thinking that we need to like move through this like crazy range of motion, but if your spine isn't remaining stable, then I think we kind of lose like the effect of the exercise.
Yeah.
Especially
that's like one thing that bothers me so much about exercise classes is like people will like sacrifice their form for like doing the heavier weights or like whatever it is, and I'm like, I'm just gonna do my 2-pounders because I know I can do it perfectly that way.
Okay.
I'm gonna get tired.
Yeah. I think honestly you get a lot more out of it like in the long run. Like I don't think, I mean, maybe initially just it's kind of like like a mental block you kind of have to like get through because we're all programmed to think like we have to lift like crazy heavy weight. We have to do these like crazy insane metcons and exercises to like really see results. But if you are continually not seeing results or you're not getting better, or you're still in pain, it's like, well, maybe we got to change what you're doing. It's like doing the same thing over and over and over again and trying to expect a different result.
Yeah. And part of it too, I feel like, is knowing how to do the exercises. Like, if you know how to do them correctly, then you won't feel that like pressure to have to like focus on the mobility versus like the stability portion of it, or like the higher weights versus the lower weight.
Right. That's true. But yeah, unfortunately, in a lot of exercise group classes, like the instructor's not really paying attention. It's hard to get that one-on-one like
Yeah.
recognition of like how you really should be doing these things. So good. Now, can we try lifting opposite arm, opposite leg?
Yeah, my shoulders need a break though.
Yeah, that's
Hold
okay.
on.
No, we've been doing that for a while. That's all right. That's good.
Like feel those muscles like.
Yeah.
Okay.
Remember to keep pushing that floor away from you and try not to lock out your elbows.
Oh, right.
Yeah. There you go. Slow and controlled, still breathing. Good. Still push the ground away. Good. Yes, that's it. Keep that. Keep that. Good. Let's do 2 more. One more. Good. All right. And then the last thing, let's have you widen your knees a little bit, just so, yeah, knees are outside of hips, still keeping toes tucked in the back. So we're going to do the rocking. Yeah, we're kind of pushing your butt towards your heels, but we're keeping those cues the whole time. Yeah, pushing the ground away, keeping that neck elongated. Yep. Inhale as you sit back. Hold at the bottom. As you come back forward, we're exhaling. And then we're slightly tucking, yeah, that tailbone. Good. Sit back again, keeping that neutral spine. Yeah, neck long, chin tucked. Come forward, we're slightly tucking the tailbone. Now we're untucking it as we come back. Good. Push the ground away. Good. Inhale as you sit back. Exhale as you come forward. I see your shoulders can come past your wrists a little bit. Yeah, if you move your, yeah, there you go. There you go. And
You
now,
feel the extension a lot more.
yes. Good. Untuck the tailbone, sit the butt back. Again, yeah, this is not like child's pose or yeah, we're not allowing that mid back to like fall through. Good. Tuck that chin a little bit. There we go. Good. Inhale as you sit back. Exhale as you rock forward. Good. Inhale. Good. Can we add the with the pelvic for the pelvic floor? So it's inhale. As you exhale, move forward. So we're just making sure we're engaging that pelvic floor by inhaling. Exhale as you push forward. Good. Still keeping that neck long, chin tucked, chest wide. Knees are slightly outside of hips in this position. Good. Let's do 2 more. Good. 1 more. Sit the butt back. Good. Inhale. Exhale. Good. Cool. How you feel?
Good.
Good.
I like those. Yeah.
Yeah,
I like doing those.
those are good.
It feels like yeah, it like just releases a lot of the tension that kind of like builds.
Yeah, absolutely.
Good stuff.
Awesome. Thank you. All right, I'm gonna stop
Cool.
the record.